Hello, my name is Dr. Marcy Forta, and I wanted to talk to you a little about some common misconceptions we have around eating disorders in honor of Eating Disorder Awareness Week. Eating Disorder Awareness Week was actually created to help raise awareness about eating disorders and to help to work to lessen the stigma that we have sometimes surrounding them. So let's dive right in and talk a little bit about some of the misconceptions we have around eating disorders. Number one is that eating disorders are actually not that common. But the reality is that the numbers show that at least 9% of the general population will struggle with one, and that Jewish girls and women might be up to 2 times as likely to be affected by an eating disorder. So, if you put that in context, it means that up to 18% of us could very realistically be affected by an eating disorder. And the second misconception that we often have is that eating disorders are a lifestyle choice. They are not. In fact, they are actually a mental health disorder similar to depression, bipolar disease, even schizophrenia. It's not an individual choice to develop an eating disorder. There are severe underlying pathological factors that can drive people to take part in these self destructive behaviors that are associated with eating disorders. They are most definitely not a choice. In fact, eating disorders are really very serious mental health disorders. There's a lot of guilt and shame that comes along with them, especially for the person struggling with the disorder. And the development of an eating disorder is an individual pathway, which is different for each person. And there are genetic and personality vulnerabilities which are interacting with their social, cultural, and environmental triggers. So it's a complicated onset, but they're not a lifestyle choice. The third misconception that we generally have about eating disorders is that they're not very dangerous. So sadly, women and girls and men who are struggling with eating disorders have a mortality rate that is 12 times higher than average for that specific age group and gender. They have the highest mortality rate of any mental illness. And without treatment, up to 20% of people with a serious eating disorder can die. Specifically, anorexia has the highest death rate of any psychiatric illness among adolescents. And I think sometimes it's challenging for us to understand the severity and gravity of this illness. But people with eating disorders are really at a higher risk for suicide and many types of mental complications. And they can affect all organs and systems of the body. So that period of time with malnutrition or not eating properly can really wreak havoc both mentally and physically on a person's health. The fourth common misconception that we often have is that you can look at someone and determine if they have an eating disorder, right? You might think, oh, I'm going to look at this person, they're emaciated, they must have an eating disorder, but that is wrong. Only 6% of people who are affected by an eating disorder can be categorized as underweight. The reality is that the vast majority of people struggling with an eating disorder are at a normal or elevated BMI. And those people who are in larger bodies struggling with an eating disorder are less likely to be diagnosed and get the help that they need so desperately. The fifth common misperception is that eating disorders can be fairly easily treated and resolved. So the average duration of an eating disorder is actually 6 years. And studies show that there is a lot of relapse in eating disorder recovery. There are struggles, there are kind of ups and downs through time. It's not a linear journey. In other words, it's not just a straight journey where we're always going in the positive direction. It might be 2 steps forward, 1 step back, or 1 step forward, 2 steps back. But it's not to say that they cannot be resolved. That is not true. Many people recover from an eating disorder and go on to live fulfilling and wonderful lives, but it's simply not an easy journey to take. And then the misperception that eating disorders are all about food. So this is kind of a big one. And while eating disorders really are manifested through food behaviors, they're not caused by food, and they're not only about food. The behaviors are often a way for people to take back control of some aspect of the struggler's life. And they use food to help them express emotions or feelings that they don't feel that they have the tools or the strength or the words to do so kind of on their own. So they have this unhealthy focus on food and weight, but the symptoms of an eating disorder can extend far beyond food. Numerous empirical scientific studies have shown links between eating disorders, perfectionism, obsessionality, which can really lead to fixation on all types of behaviors, whether that's getting good grades, performance related struggles, looking a certain way. But initially, many people who struggle with an eating disorder report that their behaviors helped them decrease depression and anxiety. They were kind of how they got through it. But as the disease or disorder progresses, the malnutrition caused by eating disorder behaviors can ultimately then lead to increased levels of depression and anxiety, can lead to cognitive impairment. So mentally, they're struggling because their brain isn't getting nourished, and it really affects every aspect of their life. Many people struggling with eating disorders simply don't have the energy or wherewithal for relationships, for friends, for projects, for things that they had a love for in the past. They simply don't have that cognitive or physical ability. So it's not all about the food. There are a lot of components that are part of an eating disorder. And then people think that young girls, really young girls, don't actually have issues with their bodies yet. And so even though most people struggling with an eating disorder are between the age of 12 and 25, the struggle begins at a much younger age. We have studies that show that there are concerns by girls about their bodies and shape starting as young as 5 years old. That means 5-year-olds are actually in treatment centers being treated for eating disorders. And while this is not very common, it's still something that's seen. 3-year-olds, the studies show, are actually already determining that they think thin is good and fat is bad. Our feelings and our thoughts around our bodies are established from a very, very young age. So this is something to really look out for with young girls. And this is an important misconception that we have, is that the eating disorder is caused by or the fault of the family or parent. You simply can't blame an eating disorder on the family or the parent. They are very complex illnesses, and they are thought to be based on biological, psychological, and cultural constructs. There's a very high level of genetic predisposition that is often a huge factor in eating disorder onset. In fact, studies show that anywhere between 40 and 60% of someone's risk for developing an eating disorder is genetically based. So the reality is that the family is actually the most helpful aspect of recovery for an adolescent struggling with an eating disorder. And sure, there might be things that take place in the family that could exacerbate an eating disorder, make it worse or more difficult for somebody, or harmful to a child's self-esteem and self-worth, of course. But there are just so many individual factors and experiences that make up risk for an eating disorder that you can't place blame squarely with one entity. And it doesn't have a positive outcome to do that. Also, people tend to believe that eating disorders are just a phase, right? That they'll go away on their own, that it's just something that they're going through right now. But true eating disorders are not a phase. They cannot go away on their own. They must be treated with trained and experienced professionals, and the preference is as early as possible in order to have the best and most positive outcomes. So oftentimes, the studies are showing that treatment for an eating disorder is not sought until between 5 and 15 years after onset of symptoms. This means generally most people are going to the doctor for their eating disorder after they have some other co-occurring problem that they're noticing. It's not for the eating disorder itself, but rather this other co-occurring issue that they're struggling with. So it's not just a phase, it's a very serious mental health issue. And then some people believe that eating disorders affect only very specific types of people, but no. In fact, eating disorders can affect people of all ages, all racial and ethnic backgrounds, all body weights, all genders. And so even though eating disorders tend to appear during the teen years or young adulthood, they can also appear during childhood, like we talked about, as young as 5 years old, or even later in life. There are stories of women who are in hospice, that is end of life care, who are afraid of having dessert or won't eat things because they don't think that they should have it. The eating disorders affect people from the age of 5 all the way to the age of 80. They, like I said, they affect all ages, all genders, all racial and ethnic backgrounds. Some people also believe that eating disorders are all about getting attention, right? That this person really wants a lot of attention. But the reality is that most people with eating disorders, the majority, actually conceal their core illness symptoms to avoid seeking specialist care. Either they're not ready to get help for it, they don't want to resolve their eating, they're ambivalent towards treatment, or they're embarrassed, or they feel stigmatized. They'll be stigmatized because of it. So therefore, it's really important that we screen, of course, for these disorders very early in primary care. But it's not a lifestyle choice. It's not about someone seeking attention. Often people diagnosed with an eating disorder will go to great lengths to hide the eating disorder and to keep it as secret as possible. And like we said a moment ago, oftentimes the only time we can get them to go to the doctor or divulge anything about their eating disorder is when they are suffering from a side issue due to the eating disorder that forces them to go to the doctor or confront it in some way. The next most common misconception is that many people will receive treatment for their eating disorder, but the reality is less than half Americans with eating disorders receive treatment for their eating disorder ever in their lifetime. So a lot of people who are struggling are doing this in silence. They're either embarrassed, like we talked about, or stigmatized, or not ready to get help, and so they're suffering in silence and by themselves. Many people believe that anorexia is the most common eating disorder, and this is simply not the case. In the United States, the most common eating disorder is binge eating disorder, and worldwide, the most common eating disorder is something called OSFED, which stands for Other Specified Feeding or Eating Disorder. And I'm not going to go into what the various eating disorders are today. That's not the point of our topic, but anorexia is actually not the most common eating disorder, either in the United States or worldwide. Many people believe that anorexia is the most serious eating disorder. It is very serious, like we talked about. It has high mortality rate, but both bulimia and OSFED that we just spoke about, that other specified feeding or eating disorder, have mortality rates that are comparable with anorexia. So people with bulimia often use laxatives or diuretics, or force themselves to vomit, and they are at a significantly higher risk of complication or sudden death from a heart attack or issues due to electrolyte imbalances. And excessive exercise can also be very dangerous. So all eating disorders have danger attached to them, not just anorexia. And many people believe that eating disorders are all about vanity and being thin. So an eating disorder serves different functions for different people. It's for most people, for most sufferers of an eating disorder, it's about control and self-worth. So they're trying to take back control of some area of their life where they feel that they don't have control, and they're using food as the way to take back that control, or controlling the way their body looks. And the eating disorder voice, because there is actually a dialogue that goes on in an eating disorder. A person with an eating disorder can make you believe that your only way of being worthy is actually to control your weight. And these thoughts can become a constant and uninterrupted internal dialogue that someone is struggling with 24 hours a day, 7 days a week. So it's not about being thin as much as it's about taking back that control and trying to build up your self-worth. And the next common misconception is that your child is just a picky eater. She doesn't have an eating disorder. So it's possible, of course, that your child might be a picky eater, but extreme picky eating that interferes with normal growth and development can be an issue. Eating disorders aren't always caused by a desire for thinness, and they aren't always caused by negative body image. In some cases, an eating disorder is actually rooted in people restricting or avoiding food for other reasons, such as they have difficulty consuming certain textures or certain smells of food or certain temperatures of food, or they have a fear, an aversive consequence. They think they're going to vomit or choke or develop an allergy, have like an anaphylactic reaction to the food. So if your child is avoiding entire food groups or has a real intense fear of food, it's a good idea to have them evaluated by a professional. And then if your loved one insists that they are fine, you should believe them. So kind of like we've mentioned throughout, problems with accurate self-awareness are one of the hallmarks of an eating disorder. So your loved one may not have the self-awareness required to recognize that there really is a significant problem. And so either they might believe that they are genuinely fine when they are acutely ill, or they might know that they're quite ill, but they're not ready to get better, and so they're not going to divulge that. They might be afraid of treatment. They're not willing to let go of the underlying issues or the coping mechanisms that they're dealing with. So you have to be really careful when they say that when they're fine and they're better. You still have to kind of watch what's going on with them. And then some people say that once my child is struggling with anorexia and she gains weight, she'll be recovered, or he. The reality is that weight and nutritional restoration are just the first steps to recovery of anorexia, and sometimes in bulimia as well. So once a person who struggles with anorexia has returned to a weight that is healthy for them, or back to a normal BMI, we will call it, even though I don't love the term BMI, they can usually participate more fully and completely and meaningfully in psychotherapy. But they will need other psychological work so that they can manage their difficult emotions that we talked about without needing to resort back to those anorexic type behaviors. So weight recovery alone is not meaning that the eating disorder is cured. That kind of means now we're ready to start real therapy and do a deep dive into what's really going on. And then our final common misperception that we'll talk about today is the idea that someone might say, my child is eating so healthy now, there can't possibly be a problem. And of course, we all want our children to eat well, and sometimes that's exactly what's happening. But any sudden or drastic change in a dietary habit might be problematic, especially if fear is involved with the particular foods or major food groups like carbohydrates or sugar or whatever it is. If your child is losing weight rapidly, suddenly becomes a vegan or vegetarian, or is unable to enjoy any food at social events without some type of anxiety, this might warrant an evaluation to ensure that they're making dietary changes in a safe and healthy way. So as you can see, eating disorders are very serious illnesses that require treatment and intervention. If you're concerned about your child, you should reach out to your child's doctor, the school therapist, or any eating disorder specialist. And if you're concerned about another family member or a friend, gently encourage them to look into speaking with someone or getting evaluated and getting some help. There are really a lot of organizations that can help you find appropriate and local practitioners who can help. Please feel free to reach out to me personally at atzmi.org. My email is marcy, M-A-R-C-Y, at atzmi.org if you need any referrals or resources or help in any way. Thank you for tuning in, and have a great day.